While depression can strike at any time of the year, the months of November and December can be extremely difficult. Dr. Brent Wallis from People's Health joins us to help viewers recognize symptoms in themselves and their loved ones, and he has some tips on how to best cope as we navigate through this holiday season that's going to look a whole lot different for all of us because of this ongoing pandemic. Dr. Wallis, good morning to you, and thanks for joining us.
Good morning. Thanks for having me.
So talk about, and I don't know if the term is proper, but seasonal depression. I know there is depression, of course, but sometimes heightened during the holiday season. In years past, what that looked like and what it could look like this year because of the pandemic.
Sure, yeah, we see a lot of seasonal depression this time of the year. I mean, I think it's a time for reflection as you get towards the end of the year. People start thinking about everything that's happened, and that can sometimes cause some feelings of sadness. I think this year, obviously, it's accentuated, through the pandemic. There's been a lot of isolation. There's been a lot of loss of sort of the usual things that we're used to doing, and that really affects people. I think also the inability to really interact with people can really take a toll over time.
So I know it's some depression is diagnosed versus sadness is just a feeling that you might have, a fleeting feeling that you might have. But what do you recommend to people who are feeling either of these feelings to recognize which is depression and sadness, or depression versus sadness, and for their loved ones who may not physically be with them to help them also recognize those symptoms?
Yeah, I think it's really important for people to understand true depression it's a medical illness, and everyone gets sad. That's very normal, but usually you do something, you distract yourself, you kind of move on. But people with true clinical depression really can't will it away. And so some of the things you want to look for, especially when you're trying to interact with your family over the holidays, is signs of decreased energy. If they're talking about their sadness, if they're talking about, eating too much or eating too little. And really what's key too is when they've lost an interest in things that they really used to do, that's a telltale sign for sure.
So we've actually run out of time, but just really quick, so you want to just remind people basically, even though we're not physically together, just to pay attention to those signs and symptoms in ourselves and in our loved ones, be it via text, be it via Google Duo like we're talking right now, but just kind of pay attention to those things and encourage people to seek help?
Yeah, I think you can really glean a lot from talking to someone and seeing how they react and stuff. It's very important to talk to your family about that or talk to your doctor. We treat both physical and mental health, so we can definitely help out as well.
Dr. Brent Wallis, we appreciate your time. Some good reminders this morning as we go into a very different holiday season in the days ahead.
Definitely. Thank you.
Thanks so much.